Welcome you all for tea time with Dr. Uma. And in this tea time, we are going to spill the tea on a lot of aesthetics and functional medicine treatments, how we can use it, and all the various stuff about that. Okay, and I am Dr. Uma, board certified physician. I'm actually triple board certified in aesthetics medicine, functional medicine, as well as anesthesiology. All right, in today's tea, I'm going to talk to you about Botox, basically toxins, the wrinkle relaxers or wrinkle reducers. Okay, let's go back to the room and see how we do the Botox. All right, so what is Botox, right? It's actually botulinum toxin A, and that helps to relax the muscles. It kind of paralyzes the muscles temporarily. Okay, so you'll get the actions back, but when you have the effect of the toxin, it's not going to move. And there are so many different toxins. Pretty much all of them do the same thing. The more common ones here are, which we carry, Botox, Xeomin, Dysport, made from 3 different companies, and all 3 of them work in the same way. The pricing is the same. The other difference one is Daxxify, and the Daxxify is supposed to last a little bit longer than the Botox or Xeomin or Dysport, and the cost of it is a little bit on the higher side compared to these 3. Okay, and what are the common muscles that we block with the Botox or any of the toxin, right? Frontalis, this muscle, like this actually makes the surprise face, and when somebody makes a surprise face, you can see them having a lot of horizontal lines. When we do the Botox, that will take away those lines. And this area is called as the glabellar complex, and this area is the popular 11s. So when we do toxins here, the 11s will go away. And then next we can also do something called as the eyebrow lift. By just injecting a little bit of Botox around the eyebrows here, we can lift the eyebrows, and we can also do the fox eye lift using just the toxins. Okay, and then the crow's feet is another common area we do. When you smile, you get all those like fine lines called as the crow's feet. For that, again, if we do the Botox, it is going to relax that. The next is something called as the nasalis, or in this area, the bunny lines we get. So the bunny lines, when you do like this, you get those lines. For that, if we inject this muscle area, it'll go away. And then coming down, we can do something around here. These muscles actually pull your lips up. So if you're getting the gummy smile, we can inject there, and that'll bring your lips down, will not pull it up too much, so the gummy smile will not happen. And then the next one around here is something called as the lip flip, where if I just put some around here, it's going to kind of not let your lip curve inwards when you smile, as well as like keep it up open, elevated like that. Plus, it kind of softens the smoker's lines, which, as we grow older, especially after 40, you start seeing it commonly. And then the next area more commonly done is around here, called for the DAOs. In other words, the famous to avoid the RBF. Okay, so we do that here. So your lip corners will not be sagging down, they kind of stay upward. But remember, if you have already a lot of tissue sagging and a lot of, big line showing down here, Botox alone is not going to help. But very minimal, it is going to help to lift it up. And the next area we can do is like along the jawline, just to relax the jawline and kind of give you a nice contour for the jawline. Same way for the masseters. The masseter muscle, Botox actually literally narrows down your lower face, and a lot of people like it for that. But also for tight masseters where at night you are clenching and TMJ issues you have, when you relax this muscle, it is better. Then same way for migraines also, we do the temples or the muscles over the temple bone, and that actually helps with the migraines. For migraines, we do different points, and that is also one of the points. Okay, and we can also do for this area, in other words, the platysmal muscle, and that is going to help with the bands that somebody gets, like when you smile or when you tighten your face, like these bands. When we put a few units there, that actually relaxes those muscles. It gives a good look, as well as it also helps to contour your jawline. So these are some of the things with the Botox, and then we can also do it for something called as trap tox or the Barbie tox, which is actually for the trapezius muscle. A lot of people have tightness here, especially if you're working on the computer all the time, or you have a lot of stress, you carry it in your traps. Then if we put some Botox there, it not only relaxes that muscle and helps you with the pain that you get from that, also it narrows down your neck, so kind of gives that Barbie neck look. So that's why it's called as Barbie tox or trap tox. Okay, I'm going to show you how I will do the trap tox next. Alrighty, so to do the Barbie tox or the trapezius tox, what I'm going to do is clean up a little bit first, and then lift up a little. There you go. Feel their tension points, and mainly feel kind of the middle layer of the trapezius. Trapezius kind of runs all the way from up there to here like a band. So, but I would mainly focus on doing the injection right there. I can feel the bulk here. So mark that. It could be different in each person, so we have to remember that. And mark it. And then clean again. And 3 quick injections. That side is done. Perfect. All done. Clean up a little bit again, and she's ready to go on her way.